This tooth is in trouble. The pulp is inflamed and the nerve is exposed. It's time for a root canal. Let's begin by locating the pulp chamber. Carefully, we uncover the roof of the chamber, and there it is. The nerve, clearly exposed. Now we search for each canal. These narrow paths lead deep into the roots. Irrigation begins using sodium hypochlorite. It's essential to flush out all infected tissue and bacteria. Proper irrigation is the foundation of success. We can now clearly see 2 canals. Using a fine endodontic file, we begin our journey to the apex of the tooth. This requires skill and patience. Now we attach the apex locator. It tells us the exact working length down to the very tip. We repeat the process for the second canal, ensuring precision. Next comes coronal shaping using rotary files. We move on to larger files, gradually widening the canals. Another round of irrigation, clean, rinse, repeat. Now we apply the sealer using a paste carrier. This fills the cleaned canals and seals them from future infection. Paper points are used to dry the canals completely. Then we finish the procedure by placing a temporary filling material. From pain to preservation, this is the art and science of endodontics. A saved tooth is a victory.